Meanwhile, Britain reported its highest death toll with a record 569 deaths being reported in one single day. It also reported the second highest increase in the number of positive COVID-19 cases, with a surge of 4,424, taking the total number of infected cases in the country to over 33,700. With mounting pressure on the government to contain the virus, the officials have promised to carry out more tests and ensure protection for frontline medical staff as well. Just a day after Britain recorded the highest number of positive cases, with 4,324 people being tested positive for the virus, Health Secretary Matt Hancock promised action. Hancock, who himself was in isolation, returned from quarantine after recovery and said that the rate of infection had been doubling every 3 days. He also said that the government had set a goal for testing 100,000 people every day till the end of this month.
The new national effort for testing will ensure that we can get tests for everyone who needs them. And I'm delighted that the pharmaceutical industry is rising to this challenge and putting unprecedented resources into testing. Taken together, I am now setting the goal of 100,000 tests per day by the end of this month.
Britain has tested 153,000 people so far, and the vast majority of those being tested are patients in hospitals. There are also growing concerns about the lack of protective gear and medical equipment to treat the patients in the front line. However, despite being susceptible to the deadly virus, the state-run National Health Service has been at the forefront in treating patients. In a gesture to thank them, Londoners came out onto their balconies and applauded them for their work. Britain's Prime Minister Boris Johnson, who is currently in self-isolation, also joined a national round of applause for doctors, nurses and other essential National Health Service workers who are combating the deadly pandemic that has crippled the United Kingdom. The gesture was first adopted by India's Prime Minister Narendra Modi to thank medical workers in India a few days ago. Growing cases of the virus is going undetected and untreated in Britain due to the lack of medical facilities. In order to fight this hurdle, the British Army has also been roped in. The Army is now setting up a temporary hospital with 500 beds for COVID-19 patients in the Penrith Leisure Centre, a sports centre in northwestern England.
The task itself is due to take 3 days. However, as always, we will remain flexible to support the NHS where possible. So if any of the tasks do come up, we will remain on standby to support that as best we can.
The lethal coronavirus has infected more than 33,700 people in the United Kingdom and has killed over 2,900 people. As of now, close to 163 patients are under critical care and 135 have recovered completely.